Welcome to Lesson 2.5, Emergency Procedures and Client Safety. Emergencies can happen without warning. A client may fall, become unresponsive, experience difficulty breathing, begin choking, have a seizure, wander away, or be affected by a fire or severe weather event. During an emergency, your actions must be calm, safe, and organized. Your responsibilities are to recognize the emergency, protect the client from further harm, contact the appropriate help, notify Agnes and Sandy's caring hands, and document what occurred. Never delay emergency assistance because you are afraid of getting in trouble or uncertain whether the situation is serious enough. Remember these 5 steps: protect, call, assist, notify, document. Protect yourself and the client from immediate danger. Call 911 when emergency assistance is needed. Provide assistance within your training, certification, and assigned responsibilities. Notify the agency as soon as the immediate emergency is being addressed. Then complete all required documentation accurately. An emergency is a situation that threatens a person's life, health, safety, or ability to remain safe without immediate assistance. You are not expected to make a medical diagnosis. You are expected to recognize serious warning signs and respond appropriately. When a situation appears life-threatening, call 911. Call 911 when the client is unresponsive, is not breathing normally, has serious trouble breathing, has severe bleeding, appears to be having a stroke or heart attack, experiences a serious injury, is actively choking, or is in immediate danger. When in doubt about a potentially life-threatening situation, it is safer to activate emergency medical services than to delay necessary care. When calling 911, speak clearly. Give the exact address, apartment number, gate code, or other information needed to reach the client. Describe what happened and the client's current condition. Tell the dispatcher whether the client is conscious and breathing. Follow the dispatcher's instructions and do not hang up until they tell you to do so. If another responsible person is present, have that person call while you remain with the client. Emergency preparation begins before an emergency occurs. At the start of an assignment, know the client's address and how emergency responders can enter the home. Review the service plan and any emergency instructions. Know whether the client has fall, choking, seizure, wandering, allergy, or mobility risks. Know where the client's emergency contact information is maintained and how to reach the agency. Do not wait until someone is unconscious to begin searching for the address. Care partners should provide assistance within their level of training and certification. If you are CPR or first aid certified, follow the methods taught in your current certification. Follow instructions given by the 911 dispatcher. Do not perform unauthorized medical procedures, administer medications without authorization, or attempt an improvised treatment because you saw it online. Help safely, but remain within your role. If a client is unresponsive, first make sure it is safe to approach. Attempt to get a response. Call 911 immediately. Assess breathing according to your CPR and first aid training. If the person is not breathing normally and CPR is indicated, begin CPR if you are trained and follow the dispatcher's instructions. If an automated external defibrillator, or AED, is available, use it according to your training and the device prompts. Do not leave an unresponsive client alone unless you must briefly do so to call for help or obtain emergency equipment. Severe breathing difficulty is an emergency. Warning signs can include gasping, struggling for air, inability to speak normally, blue or gray coloring around the lips, sudden confusion, or loss of consciousness. Call 911. Keep the client in a safe position that supports breathing unless moving them would be unsafe. Loosen restrictive clothing when appropriate and follow instructions from emergency dispatch. Do not give food, drinks, or unapproved medication during a breathing emergency. Possible heart attack symptoms can vary. A client may experience pressure, squeezing, fullness, or pain in the chest. They may have shortness of breath, sweating, nausea, unusual weakness, or discomfort that spreads to the arm, back, neck, jaw, or stomach. Do not drive the client to the hospital yourself unless emergency authorities specifically direct otherwise. Call 911 and follow the dispatcher's instructions. Do not independently give aspirin, medication, food, or drink unless the client's approved plan and qualified medical direction permit it. A stroke requires immediate medical attention. Remember FAST, face drooping, arm weakness, speech difficulty. Time to call 911. Other possible symptoms may include sudden confusion, vision problems, dizziness, loss of balance, or a severe sudden headache. Note the last time the client was known to be normal, if you know it, because emergency personnel may ask. Do not wait to see whether the symptoms disappear. A person with mild airway obstruction may still be able to cough or speak. Encourage effective coughing while closely observing them. A person with severe choking may be unable to breathe, speak, or cough effectively. Call 911 and provide choking care according to your current first aid or CPR training and the dispatcher's instructions. If the client becomes unresponsive, lower them safely if possible and begin the appropriate emergency response. Choking can quickly become life-threatening, so do not leave the client alone or delay calling for help. Medline Plus emphasizes that choking requires rapid action and may require back blows, abdominal thrusts, or CPR depending on the situation and the rescuer's training. Choking prevention is just as important as emergency response. Follow the client's approved food texture and dietary instructions. Make sure the client is positioned appropriately for meals. Do not rush feeding. Provide the required supervision and never give unapproved food because the client or family member says, "Just this once." Report coughing during meals, difficulty swallowing, pocketing food, or repeated choking concerns to the agency immediately. Most seizures end within a few minutes, but the person should be protected from injury. Stay calm and clear dangerous objects from the area. If the person is falling, ease them to the floor when safely possible. Place something soft and flat beneath the head. Turn the person gently onto one side when possible to help keep the airway clear. Time the seizure and remain with the client. The CDC recommends these basic protective actions during a seizure. Do not restrain someone who is having a seizure. Do not place a spoon, fingers, medication, or any other object in the person's mouth. A person cannot swallow their tongue. Do not give food or water until they are fully alert and able to safely swallow. Protect them from injury and monitor their breathing. Call 911 when a seizure lasts longer than 5 minutes. Another seizure begins soon afterward. The person has difficulty breathing or waking. The person is injured. The seizure occurs in water, or it is the person's first known seizure. Follow any client-specific seizure protocol in the service plan. The CDC specifically advises immediate medical assistance when a seizure lasts more than 5 minutes and identifies additional circumstances when emergency help is necessary. Falls are a serious concern in home care. They are a leading cause of injury among adults age 65 and older. If a client falls, do not panic and immediately pull them up. Tell the client to remain still while you assess the situation within your training. Determine whether they are awake, breathing, bleeding, in severe pain, or showing signs of a serious injury. Follow the client's service plan and agency fall procedure. Do not move or lift a client when you suspect a serious injury unless remaining in place creates a greater immediate danger, such as fire. Movement could worsen a head, neck, back, hip, or other injury. Call 911 and follow the dispatcher's instructions. Keep the client as comfortable and still as possible without repositioning them unnecessarily. Never attempt to lift a client from the floor by pulling on their arms or clothing. Do not risk injuring the client or yourself. Even if a client says they are fine, follow the agency's fall procedures. Assistance may be needed before the client can safely get up. All falls must be reported and documented according to agency policy. including falls where no injury is immediately visible. Many falls can be prevented. Keep pathways clear and lighting adequate. Make sure mobility equipment is accessible and used according to the service plan. Do not encourage a client to walk without required assistance because you are in a hurry. Keep frequently used items within safe reach. Report new weakness, dizziness, balance changes, or repeated near falls. The CDC notes that older adult falls are common but preventable and provides prevention resources for clients and caregivers. Severe or uncontrolled bleeding requires emergency help. Call 911. Protect yourself from blood exposure by using gloves when available. Apply firm, direct pressure with appropriate material if you are trained to do so and there is no embedded object. Follow the dispatcher's instructions. Do not remove a deeply embedded object and do not repeatedly lift the dressing to check the wound. If blood soaks through, follow your first aid training regarding adding additional material while maintaining pressure. First, stop the burning process when it is safe to do so. Call 911 for major burns, burns involving the face or airway, electrical burns, chemical burns, or any situation where the client appears seriously injured. For a minor thermal burn, follow your first aid training. Do not apply ice, butter, grease, toothpaste, or other home remedies. Do not break blisters or remove material stuck to the skin. Care partners generally provide medication reminders only when that service is authorized. If a client takes the wrong medication, the wrong amount, takes a dose twice, or shows signs of a serious reaction, do not guess about what to do. Call 911 for severe symptoms, loss of consciousness, breathing difficulty, seizures, or suspected life-threatening overdose. Otherwise, immediately contact the appropriate supervisor and follow agency procedures, which may include contacting poison control or the client's licensed healthcare provider. Never make the client vomit or give an unapproved substance unless emergency professionals direct you to do so. Medication errors and concerns must be reported immediately. Do not alter documentation. Do not attempt to correct the situation by giving another dose. Do not wait until the end of the shift. Immediate and truthful reporting gives the client the best chance of receiving appropriate guidance and care. During a fire, protecting life comes first. Remember RACE. Rescue anyone in immediate danger when it is safe to do so. Activate the alarm when available and call 911. Contain the fire by closing doors if this can be done safely. Evacuate using the client's emergency plan. Never remain inside attempting to fight a spreading fire. Never use an elevator during a building fire unless emergency authorities direct you to do so. A fire extinguisher should only be used on a small, contained fire when you have been trained and have a clear escape route behind you. Your first responsibility is evacuation and emergency notification, not saving property. If the fire grows, smoke becomes heavy, or you are uncertain, leave immediately. Severe weather can affect client safety, especially when a client relies on electricity, mobility equipment, medication refrigeration, oxygen, or other essential support. Follow the agency's emergency preparedness plan and the client's individual instructions. Know the safest area of the home and the client's evacuation needs. Do not independently transport a client during dangerous conditions unless authorized or necessary to escape immediate danger. During a tornado warning or immediate severe wind threat, move the client to the designated safe area when it can be done safely. This is generally a small interior room on the lowest safe level, away from windows. Follow the client's mobility and transfer instructions. Bring a charged phone and essential emergency information when available without delaying movement to safety. A power outage can become an emergency depending on the client's needs. Determine whether any essential equipment depends on electricity. Consider lighting, home temperature, medication storage, communication ability, and the client's mobility. Notify the agency promptly and follow the emergency plan. Call 911 when loss of power creates an immediate threat to life or safety. A missing client, particularly someone with dementia or cognitive impairment, is an emergency. Quickly check the immediate area without leaving other vulnerable individuals unattended. If the client cannot be located, call 911 promptly. Provide the client's name, description, clothing, condition, last known location, direction of travel if known, and any mobility concerns. Notify the agency immediately. Do not delay the report because you are embarrassed or believe the client will probably return. Follow the client's service plan for wandering prevention. Maintain the required level of supervision. Do not leave a client with known wandering risk alone in a vehicle, store, restaurant, park, or other public setting. Report increased confusion, exit seeking, restlessness, or new wandering behavior. Never lock, restrain, or confine a client using an unauthorized method. Never leave a client unattended when supervision is required. This includes leaving briefly to use a restroom, purchase something, take a phone call, or complete a personal errand. Never leave an assignment before authorized relief arrives when the client cannot safely remain alone. If an urgent personal situation occurs, contact the agency so safe coverage can be arranged. Care partners should observe the home for significant safety hazards. If you smell gas, do not operate switches or create a flame. Leave the area and call 911 or the gas emergency service from a safe location. Report blocked exits, dangerous wiring, severe sanitation problems, uncontrolled animals, threats of violence, weapons being used dangerously, or other serious concerns. Do not place yourself in danger to complete an assignment. Care. Partners are not expected to remain in an environment involving active violence or a credible immediate threat. Move to safety and call 911. Do not attempt to disarm someone or physically manage a violent situation unless immediate action is unavoidable to protect life and falls within your training. Notify the agency and do not return to the location until instructed that it is safe. If a vehicle accident occurs while transporting a client, stop in a safe location when possible. Call 911 for injuries, danger, or when legally required. Do not move an injured person unless there is an immediate hazard. Keep the client supervised and follow the agency transportation policy. Never leave the scene, argue with other drivers, or admit fault on behalf of the agency. Notify the office and complete the required transportation and incident reports. Emergency responders may ask for information about the client. Provide authorized and relevant information that supports the client's emergency care. This may include known medical conditions, allergies, medications, emergency contacts, and advanced directive information. Do not delay calling 911 while attempting to assemble a perfect file. Emergency help comes first. Some clients may have an advanced directive or a do not resuscitate order. Care partners should not interpret legal or medical documents independently. Know where verified documents are located when identified in the client's care information. During an emergency, call 911 and follow agency procedures and dispatcher instructions. Never withhold emergency action based only on something a family member says or on an unverified document. Once emergency help has been activated and the immediate situation is being managed, notify the agency. Do not wait until the end of your shift. State what happened, the client's current condition, what actions you took, whether 911 was called, and where the client is being transported if applicable. Follow instructions regarding family or emergency contact notification. Do not post or discuss the emergency with unauthorized people. Remain with the client until emergency responders, an authorized representative, or another appropriate person assumes responsibility, unless staying would place you in danger. Do not follow an ambulance in your personal vehicle unless authorized. Do not transport other family members or take on additional responsibilities without agency direction. An emergency call does not replace the agency's incident report. Complete required documentation as soon as possible after the client is safe and immediate duties are complete. Document objective facts in chronological order. Include what you saw, what the client said, what actions you took, who you contacted, when you contacted them, and the outcome known at that time. Georgia's home care rules require providers to maintain procedures for handling emergencies and incidents affecting service delivery. Documentation should be factual, specific, and free from blame. Record the client's position, visible condition, statements, symptoms, actions taken, times, and notifications. Do not speculate. Do not write that a person had a stroke, heart attack, broken hip, or other diagnosis unless that information is provided by an authorized medical professional. Document what you observed. Never alter a record to make the situation appear less serious. Do not hide an incident because you believe it could lead to disciplinary action. Do not ask a client, family member, or coworker to change their account. Truthful and immediate reporting protects the client and allows the agency to respond appropriately. Not every change requires 911, but every significant change should be handled appropriately. An unresponsive client or severe breathing problem is an emergency. A new skin concern, reduced appetite, or increasing weakness may not always require 911, but it may require prompt reporting. Routine changes should still be documented and communicated according to the service plan. When you are uncertain whether the client is experiencing an emergency, contact emergency services rather than delaying potentially life-saving help. Do not pull the client up. Encourage them to remain still. Call 911 because a serious injury may have occurred. Keep the client safe and comfortable without unnecessary movement. Notify the agency and complete the required incident documentation. Treat this as a possible stroke. Note when the client was last known to be normal, if known. Call 911 immediately. Do not give food, liquids, or medication unless directed by emergency professionals. Notify the agency after emergency assistance has been activated. This is severe choking. Call 911 and provide care according to your current CPR or first aid training and dispatcher instructions. Remain with the client and be prepared to begin the unresponsive person response if their condition worsens. Quickly check the immediate area while maintaining your own safety. Call 911 promptly when the client cannot be located. Provide an accurate description, last known location, and relevant medical or cognitive information. Notify the agency and preserve an accurate timeline. Do not delay because you are afraid of disciplinary consequences. Follow the client's emergency plan immediately. Determine whether backup power is available and whether the client is in immediate danger. Call 911 when loss of power threatens life or health. Notify the agency promptly and follow instructions regarding evacuation or emergency support. Remain calm and explain that the symptoms may represent a serious emergency. Follow the client's service plan, agency policy, and emergency procedures. Contact 911 when the client appears unable to make or communicate a safe decision, becomes unresponsive, or the situation presents an immediate threat requiring emergency intervention. Notify the agency immediately and document the client's exact statements and your actions. Do not argue, threaten, or physically force the client, but do not ignore a life-threatening condition. Emergencies require calm action and good judgment. Know the client's emergency information before something happens. Call 911 for immediate threats to life or safety. Provide assistance within your training and follow dispatcher instructions. Protect clients from unnecessary movement, unsafe lifting, wandering, abandonment, and environmental hazards. Notify Agnes and Sandy's caring hands as soon as emergency assistance is underway. Finally, document the event truthfully, objectively, and completely. Remember the 5-step emergency response rule: protect, call, assist, notify, document.